Hi, I'm Jo Vearey, Associate Professor and Director of the African Centre for Migration and Society at Wits University. And I am co-lead on Work Package 4 that is exploring the impacts of the global compacts on the governance of international protection.
Hello, I'm Christina Jacobsen. I'm a professor of social anthropology at the University of Bergen in Norway, and I'm co-lead on Work Package 4 together with Jo. So in Work Package 4, we conduct a fieldwork study of how governance of international protection works in selected migration arrival ports in the European Union, Canada, and South Africa. The work package has three main objectives: to map how actors collaborate to address and reduce vulnerabilities, taking into account intersecting structures of domination and exclusion related to gender and legal status in particular; to investigate how key actors and stakeholders involved in field level governance understand and apply the notions of vulnerability and specific needs; and three, to assess how the global compacts on migration and refugees and the common European asylum system impact the understanding and application of vulnerability and specific need in the field level governance of international protection.
Our first round of research, which was conducted mostly online due to the impact of COVID-19, involves ethnographic fieldwork, which involves participant observation, open-ended and semi-structured interviews, and exploring the use of collaborative methods. Fieldwork's been conducted in the selected sites across Greece, Italy, Spain, France, South Africa, and Canada. In line with our continuity and contingency plan that was made in light of the COVID pandemic, we have been able to undertake some initial identification and mapping of relevant organizations through remote and online fieldwork, which has included website and document analysis and some preliminary interviews. The emergency situation resulting from the pandemic has created different possibilities and limitations for access and different methodological and ethical considerations across each of the 6 field sites. Drawing on 2 examples, one from the Marseille case study and one from Messina in South Africa, we can unpack some of the initial findings from these spaces where we are looking at mapping of actors in key areas of collaboration. The composition of ground level actors varies from site to site, and we know that international organizations, for example, UNHCR, the IOM, regional organizations such as the European Union or the African Union, and transnational non-state organizations, Doctors Without Borders, the International Federation of the Red Cross, are present in some of the locations, but not in all. In some locations, smaller non-governmental organizations play a large role in the governance and reception of migrants, and the role of states or subnational structures, municipalities, and very local level responses, including the interaction between these different governance levels, varies across the sites. In Marseille, an example of mapping of key actors, which has undertaken a way of providing an overview of the fast-changing myriad of ground-level actors and how they collaborate to address and reduce vulnerabilities, was undertaken through interviews and observations, as well as collecting documents and mining available online sources. Findings indicate that the collaboration between civil society actors specialized on asylum and migration and the state actors specialized on asylum governance. And this appears to be difficult or non-existent in terms of the role of the state actors. Daily routine collaboration between governance actors seem to be largely based on interpersonal relations of professionals and volunteers. Some platforms and networks of collaboration and coordination do exist between civil society actors. So on the slide here, you'll see an interactive online map that was made by the Transborder Collective's Project QX1 in Marseille. It was a platform enabling the exchange of information between migrants arriving in or transiting through Marseille. And the name comes from the International Maritime Signals Code, where it signifies the permission to anchor. The platform, run by a collective of local institutions and NGOs, was intended to be a tool offering mutual aid, to share advice on housing, asylum law, connecting with NGOs, for example, and access to soup kitchens. The information was based on interviews with migrants and emphasized the value of testimonies from people of different origins and profiles. So this was an example of collaboration from below that foregrounded migrants' own voices and experiences. When we started online fieldwork, the site was no longer being updated due to a lack of resources, exemplifying how efforts to collaborate can easily fade when specific funding terminates or a particular person disappears. In the context of Messina, the South African case study bordering Zimbabwe, a different form of collaboration can be found. This example shows collaboration between a research institution, in this case, the center that I'm based at, and its XenoWatch platform, with local civil society, in this case, the Messina Legal Advice Office. Developed by ACMS at VIT, XenoWatch is a tool to monitor xenophobic discrimination. It's an open source system for information collection and sharing. As a non-proprietary platform, it collates, visualizes, and makes publicly available data, for example, from media reports, research, and other forms of crowdsourcing on xenophobic discrimination incidents in the country. Activists, victims, and observers can report violence through various channels, including free SMS, email, there's a mobile app, WhatsApp calls, for example. Research assistants or monitors have been added to the XenoWatch team across the country. And in Messina, this includes Mr. James Chirwa, who is based at the Messina Legal Advisory Office.
Vulnerability has acquired growing importance in current policy discourses on asylum and migration, but is a contested term. While the notion of vulnerability features prominently in the Global Compact for Migration, the Global Compact on Refugees has largely adopted a language of specific needs. So an illustration of this is that whereas the Global Compact for Migration mentions vulnerability 17 times, it appears in the Compact on Refugees only twice. Despite its increasing presence within the policy discourse, the practical relevance of the ideas of vulnerability and specific needs to the implementation of global migration and refugee governance regimes remains unclear. Behind the political label of vulnerability, we find a diversity of registers, interpretations, and operationalizations among governance actors, including states, international organizations, and civil society actors. The governance actors that we mapped in our first round of online fieldworks participate in various ways in identifying, assessing, measuring, comparing, monitoring, and addressing vulnerability. Some of the actors focus on formal vulnerability assessments based on national or international legislation to identify vulnerable persons and persons with specific needs. Other actors developed special measures for groups identified as vulnerable, such as, for instance, isolated minors or LGBTQ refugees. Other actors, again, such as charities and activist organizations, offer assistance to all migrants and refugees independently of any vulnerability or needs assessment. We've barely started to analyze how various actors understand and operationalize the notions of vulnerability and specific needs. But let me nevertheless point to some topics that seem worthwhile to pursue further in our analysis. I work on Marseille. I will give some examples from the French context. One thing that emerges from our data and that seems worthwhile exploring is how vulnerability and specific needs work as filtering devices in migration and refugee governance. We're seeing examples of how these concepts and their operationalization justify the restriction of some rights and services to those identified as particularly vulnerable, thus allowing for more restrictive policies towards those identified as non-vulnerable or less vulnerable persons. One example is housing policies in Marseille. The assessment of vulnerability in relation to accommodation has been understood and operationalized in a gradually more restrictive manner by local authorities. For instance, from 2018, only women who are 8 months pregnant or more and who possess a medical certificate are considered as having a specific need for housing. In this sense, the very notion of vulnerability and its limitations can be understood as a political tool aiming at managing the structural shortage of budgetary funding allocated to reception conditions of asylum seekers. A second theme that emerges as worth exploring is the tensions between different understandings of vulnerability and specific needs. For instance, in 2020, France was condemned 4 times by the European Court of Human Rights. The applicants, categorized by the French administration as isolated asylum seekers, that is, single men, and thus not considered as vulnerable, were recognized by the ECHR as victims of degrading treatment, showing a lack of respect for their dignity. The court concluded that the French authorities were responsible for the conditions in which the applicants had been living for several months, sleeping rough, without access to sanitary facilities, having no means of subsistence, and consistently in fear of being attacked or robbed. Such tensions between different understanding can include tensions between categorical or group-based and more situational understandings of vulnerability. Whereas the former identifies, for instance, women and minors, prioritizing their access to accommodation, material support, and sometimes specific procedural guarantees, the latter focuses on how, for instance, unequal access to resources and recognition exacerbates people's vulnerabilities. While the former is operationalized largely as a process of identification and prioritization, the latter also entails responsibilizing states for the production of conditions of vulnerability. In the final analysis, we hope to be able to relate some of these tensions to the overall theoretical framework of PROTECT. Now, a third theme worth exploring are tensions between the points of view of governance actors and migrants themselves. The ethnographic approach allows us to explore how these populations understand vulnerability and the practices put in place to meet specific needs. We see examples in our material of migrants questioning the meaning of vulnerability and the ways it is operationalized. PROTECT researcher Pascaline Chapin has written about how members of a self-organized group of asylum seekers in Marseille challenged the authorities, staging a march and carrying banners asking, "Who are the vulnerable people?" Calling on the French Office for Immigration and Integration to take responsibility and respect the rights of asylum seeker, they asked, "Isn't a destitute person vulnerable? Tell us, what is vulnerability? We don't understand." Banners also reflected the sexualized and gender dimensions that frame public assistance policy and the contradictory practices of the immigration authorities regarding the foremost moral imperative to protect women and children first. As you can see on the banner on the slide here, they asked, "Isn't a pregnant woman vulnerable? Isn't an isolated woman with children vulnerable?" Indeed, beyond the denunciation of the French non-reception policy, these asylum seekers question the very relation of rights and duties between the state and vulnerable people seeking protection. A fourth theme that emerges across the contexts is how COVID is also affecting understandings and ways of addressing vulnerability. And Joe will talk to this.
So just briefly, what we are seeing across all the sites is the ways in which the pandemic is amplifying the challenges that were already being faced by different foreign nationals in each country. In particular, asylum seekers, refugees, and undocumented individuals. This includes the ways in which a reliance on public healthcare services and the challenges that existed in accessing those prior to COVID have been further stressed. We know that there is an urgent need to ensure that nobody is left behind in our responses, including in COVID vaccination programs. So this form of vulnerability needs to be better understood in the context of the greater public good. PROTECT researchers involved in Work Package 4 have been involved in various pieces of work looking at the impact of the pandemic on vulnerabilities, including a series of blog posts that can be found on the PROTECT website.
So to summarize briefly with regard to the main objectives of Work Package 4 that I presented initially, we see that actors and collaboration between them are context specific. We see that vulnerability and specific needs are contested concepts on the ground. It is too early to say much about the impact of the global compacts on local governance, and more particularly on how vulnerability and specific needs are understood and addressed. However, our provisional data suggests that de facto forms of governance are not always aligned to the formal global governance architecture. In many contexts, the global compacts are not a reference point for decisions or discussions at the local level.